Hello, I'm Brianna Turner, and today I will be performing a head to toe assessment. Knock. Hello.
Hello.
Hi, Miss Johnson.
Yes.
Can I call you Jasmine?
Sure.
I'm Brianna, a CSU nurse practitioner student, and I will be performing a head to toe assessment on you today.
Okay.
Okay, so we can get started. I'm just gonna go wash my hands and put on some gloves, okay?
Okay.
Actually, I will put on the gloves after I feel your skin. So today we're gonna do a head to toe assessment. This is a comprehensive exam over pretty much every body system. It's a brief exam over each body system to get a comprehensive overall take on your health and wellness, okay?
Okay.
Okay, so first we'll just start with just the basic things. Your skin is the biggest organ of your body, so we're gonna just inspect your skin first. So I'm just gonna take a look at your skin where I can visibly see. Okay, any rashes or wounds anywhere that I can't see, like on your bottom or your breast?
No.
Okay. Just gonna lift up your. Okay, so skin is within normal limits for ethnicity. I am not seeing any wounds, any lesions. The texture of her skin is smooth. I do notice a bruise here. Are you aware of that?
Yes.
Okay, what happened?
I ran into a car door.
Oh, wow. Well, does it feel better?
Yeah, it feels better. It was hurting the other day though.
Okay. I'm just feeling skin is pretty dry. Temperature is warm. Everything looks great. Overall, everything looks good. Okay, so I am going to take a look here at your hair. Patient is wearing extensions, so I'm not actually able to assess your hair. Would you say, overall you have healthy hair?
Yes.
Okay, I see that a portion of it is left out. This is yours at the top, correct?
Correct.
Okay, and it's shiny and it looks very healthy. Thick hair, looks good. So would you say that your hair is evenly distributed?
Yeah.
Any patches or bald spots that you know of?
No.
Okay, and is it shiny like that all over?
Yes.
Okay, perfect. And I'm just going to feel your skull, okay? Because you just let me know if you feel any tenderness anywhere.
Nope.
No tenderness? Okay. And just take a look at me. I'm just going to look at your face, make sure everything is pretty symmetrical. It is. So I'm going to go ahead and place on my gloves. So what we're going to do is kind of examine several, different cranial nerves, different structures of your face. So I'm just going to put on gloves since I'll be in your face quite a bit, okay? We're going to do a few tests. Okay, so, and at some point we'll take your glasses off. Is that okay?
Mm-hmm.
Okay, so your face looks symmetrical. I'm not seeing anything, noticeably that, we would want to treat or anything. Do you see a few bumps? Do you see a dermatologist?
And not in the past few years.
Okay. But no. Your skin is actually very soft and pretty on your face. Okay, so what we're gonna do is we're gonna test your TMJ. It's a joint, so it's a joint that you use to chew your food, you swallow. When you're chewing, do you notice any clicking sounds or any pain?
No.
Okay. So what we're gonna do is, could you open your mouth for me and close it? So open, close, open, close. Okay? You can stop. Did you feel any discomfort while doing so?
No.
Okay. So we are going to check cranial nerve number 5. And that is the trigeminal nerve. And what we do here is we'll kind of do some motor things. I'll have you doing some things with your mouth. And then we'll kind of do like a little sensory test, okay? So I'm going to just place my hand here on your temporal. And I want you to clench your teeth. Perfect. You can stop. I'm going to place it here. Clench. Great. Let's see. Could you open and close your mouth? Move your jaw side to side. Great. So now what we're going to do is, I'm going to tell you when, but basically for this next test, you're just going to close your eyes. And I'm going to have 2 objects. One is going to be sharp, one is going to be dull. And I'm going to touch your face at different spots, and then you will just say whether it's sharp or dull. So if I touch right here and it's dull, you'll just say dull.
Okay.
Sharp. Got it?
Okay.
All right. All right, eyes closed.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull.
Perfect. You can open your eyes now. Alrighty. And what's your birthday?
January 7th, 2000.
And what do you enjoy doing?
School.
Don't worry. Like I said, I am just doing a full assessment. So I'm talking to you, just trying to see how different, movements, trying to make sure everything is symmetrical while you're talking. So feel free to look away or laugh. I know this can be silly because it seems like I'm just all up in your space. So now we're just going to check your facial nerves. Could you raise your eyebrows up? Okay, you can put them down. A big smile. Okay. Big frown. Okay. Now puff your cheeks out like a puffer fish. Perfect. Okay. And let me see, upper and bottom teeth. Great. And now you're going to close your eyes as tightly as you can. And don't, just keep them closed. Okay, perfect. So cranial nerves, facial nerves, and trigeminal nerve is intact. So we will move on to your eyes. So I just want you to look straight ahead. I'm gonna assess your eyes. First, I'm just gonna look without my light. You have an eyelash? Okay, I'm just gonna look without my light. Okay, your sclera is white. Kind of seem like your eyes is a little irritated. Like you've kind of just woke up. Do your eyes burn or anything?
No.
Okay. Looking at your pupils and your iris. Okay, I'm just taking a look at your eyelids. Could you close your eyelids? Perfect. You can open them. look here. Okay, so we're gonna check more cranial nerves, 3, 4, and 6. Okay, so your oculomotor, trochlear, and abducens. You're gonna look at my pen,
Okay.
and then you're just gonna follow the pen. Okay. Perfect. So I'm gonna use the pen light, and I'm gonna take a look at your pupils. Okay, so your pupils are equal. They're both round. They're reactive. To light. Could you look at the TV in the back? Now look at my pen. Okay, so pupils are equal, round, and reactive to light and accommodation. All right, so eyes are looking good. Here's your glasses. We're done with the glasses. Well, the eye exam, I guess you can call it. All right, so now we're just going to take a look at your ears. I'm looking at the auricle, which is just the outside of your ear. I'm looking for any crusting, swelling, redness, any irritation, ulcers. Any tenderness when I pull up or downward on your ear?
No.
Okay. Alrighty, so I'm gonna take a look at your tympanic membrane, which is just another word for eardrum, okay? Okay, so your eardrum appears to be a grayish whitish colors, no bulging, no redness. It doesn't look like it's any swelling or irritation. Do you have any discomfort in your ear?
No.
Okay, it looks great. I'm just gonna feel your mastoid bone. Any pain while feeling the bone?
No.
Okay, so now we're gonna check cranial nerve number 7. This nerve is the acoustic nerve. We actually do that in 2 ways, and actually you may be exempt from us testing it. We use a tuning fork or a audiometry test to test it, but I do believe you had an audiometry test in the last year.
Mm-hmm.
Could you pronounce that word?
Audiometry.
It's a very silly word. But you did have one of those tests done within the last year, so we could skip that test. So what we'll do is we will still test you. We'll do the Weber test, that test for lateralization, and then we will do the Rhine test, which compares air conduction and bone conduction. Okay.
Okay.
So I'll walk you through each test. The first test that we'll do is the Weber test. So I have I have a fork here, and I am going to make the fork vibrate, and I'm going to place it on top of your head.
Okay.
It's going to be right in the middle of your head, midline. And I want you to tell me which ear do you hear the sound out of the best, or both. Okay?
Okay.
All right. Are you ready?
Mm-hmm.
Okay. Okay.
Out of both.
You hear out of both equally?
Mm-hmm.
Okay, perfect. So now we're gonna do the Ryan test. With the Ryan test, I am going to, same fork, it's gonna vibrate, but I'm gonna put it that mastoid bone that I just felt.
Okay.
And you are going to hear sound. As soon as you hear the sound stop, I want you to let me know, and then I will move the fork to the side of your ear, and I want you to let me know whether or not you hear anything, okay?
Okay.
All right.
Okay.
Do you hear anything?
Yes.
Okay. Perfect. So basically what that test does is it compares sound through air conduction and bone conduction. So you heard the sound through your bone when it was placed on your mastoid bone, and then you also heard it next to your ear. So when you stop being able to hear it through your bone first, that's normal because sound travels better through air, right?
Mm-hmm.
Okay, so now we are going to kind of just inspect your mouth. And I have gloves on, so I'm gonna be touching your mouth and just kind of looking, okay? So I'm just gonna take a look here at your lips. Lips are symmetrical. I do notice a bump right here. Is that normal, or is it probably just an acne spot, or is it something that you get like seasonal, or when you stress or when you cold?
I guess it's acne.
It's acne. Okay, so I'm just gonna take a look at your mouth. Could you open wide for me? Okay. I'm gonna take a look here at your teeth. Okay, no missing teeth. Let me check, make sure no cavities. Okay, no cavities. Could you stick your tongue out for me and say ah? Perfect. I'm just gonna look at the back of your throat. Okay, your uvula, midline, it does not appear swollen or red. That's perfect. I'm gonna look up at your palate. I see that it's white and moist. Great. Irregular ridges. Perfect. I'm gonna look at your buccal mucosa. Okay, it's pink and moist. Okay, I'm just gonna kind of pull your lip back. Take a look here. I'm not seeing any ulcers. Any ulcers anywhere in your mouth. Perfect. Okay, great. One thing that I do notice, I think that I did not do was like a general survey at the beginning of my head to toe assessment. So the patient is 24 years old, African American female. She came into the office just for a annual exam. She is well kept, good hygiene. She does not seem to be in any distress. She is cooperative, and she is giving great eye contact. So, done looking at your mouth. Let's see here. So now we're gonna check a few reflexes, okay?
Okay.
So one of the reflexes that we're gonna check is your gag reflex and your swallow. So I do have a tool here to check that reflex. Do you mind if we do the gag reflex test? Okay. So what we're gonna do is we're checking cranial nerve 9 now, okay? So you're gonna stick your tongue out and you're gonna say ah, and I'm just gonna see if I can elicit a gag reflex. Perfect. It's sometimes hard to tell when using that tool. Now could you just swallow for me? Okay. So swallowing is intact. Cranial nerve number 9 is intact. So now what we're going to do is we're going to swallow and speak. So I just want you to take like a swallow and tell me what school you go to.
Troy University.
Okay, so no hoarseness noted. Cranial nerve 10 seems to be intact. Now I just want you to stick out your tongue and move it side to side. Okay, perfect. Cranial nerve 12 is intact. So now what we're going to do is we're just going to move down and kind of come to your neck. So I'm just going to inspect your neck, okay? Any tenderness or anything noted in your neck?
No.
Any difficulty or pain while swallowing?
No.
Okay, so no problems with your neck?
No.
Okay, I'm just going to feel your trachea, so you can kind of hold your head back a little bit. Any tenderness?
No.
Okay, and now I'm going to kind of just feel your thyroid gland, okay? Okay. So now what I'm going to do is we are going to check some more nerves. So now I'm going to kind of push down on your shoulders and I want you to shrug up. So I want you to resist. I want you to try to resist me pushing down, okay?
Okay.
All right. Okay, perfect. Now we're going to do the same with your head. I'm going to push on your side of your face and you're going to resist, okay? You're going to push the opposite way.
Okay.
Okay, let me know when you're ready.
I'm ready.
Okay, perfect. All right, great. So now I just want to kind of check your lymph nodes out a little bit. Okay, so just gonna feel your lymph nodes, your tonsillar lymph node, your cervical lymph nodes, your periocular, clavicular lymph node, okay, submental, and submandibular. Have you noticed any tenderness in your lymph nodes?
No.
No swelling? No. Okay. So now what we will do is now we're going to focus on your chest, lungs, thorax area. Any coughing or anything?
No.
Palpitations, irregular heartbeat?
No.
Okay. So I'm just gonna observe the rise and fall of your chest. Okay. So the rise and fall is symmetrical. Chest seat appears to be a normal adult chest. I don't see, it's not barrel, it's not pigeon chest. Respiratory efforts, no distress. Respiratory is unlabored, breaths are unlabored. Steady, normal rhythm. Okay, so now what I'm going to do is, let's see, I am going to feel your precordium. I know you're kind of bigger chested, so it's trying to see what's going to be the best way. If you could just lay back and I'll do it this way. So right now I'm going to feel your precordium. What that is that that's the chest wall above your heart and your lower chest wall, basically. Okay, and now I'm kind of feeling for your apical impulse, which is just basically the pulse right here at the apex of your heart. Okay, you can sit up. I'm gonna feel your carotid artery. Okay, perfect. +2 pulse in your carotid artery. That's great. I'm gonna feel your supraclavicular lymph nodes, and then your auxiliary lymph nodes. So if you just lift up your arm, it's kind of like the ones right here, your armpit. Any tenderness or anything that you've noted?
No.
Okay, perfect. So now what I'm going to do is I'm going to listen to your heart sounds. Okay, I'm going to start here on your right side with your aortic. Perfect. Your pulmonic. Your herb. Okay, I'm gonna kind of, your tricuspid, I'm gonna kind of lift your, let me see, your tricuspid. And your mitral. Okay, and now we're just, I'm sorry, we're gonna listen to your, well, I'm gonna listen to your lung sounds. Each time I put the stethoscope down, just feel free to take a deep breath in and out, okay? Okay. Lung sounds are clear. Not hearing any crackling, any wheezing. Lung sounds clear in each quadrant. Heart sounds, rhythm was within normal. Well, rhythm was normal. I didn't hear any murmurs. I didn't hear any friction rubs, any gallops. I could hear the S1 and S2 beats. So far, so good. Now I am going to move to your back. Okay, I'm just looking. Chest configuration, symmetrical. Respiratory effort, it appears to be unlabored back here. I'm gonna check your chest expansion. Could you take a deep breath in and a deep breath out? Okay, again. And then I am going to take a listen back here. And you could in and out, okay? Okay, thank you. So long sounds clear posteriorly as well. So that's good. Now what we will do is see. I'm checking your costovertebral angle. Could you sit up straight, please? Okay. All right. We're done there. What we're gonna do is your abdomen. Abdomen appears to be round. So stomach appears to be round. All right, so I am going to check and see, you know, if I can feel any aortic pulsations. So if you could lay back and kind of bend your knees, put your feet on the bed and bend your knees. Okay, I do not feel any pulsations. I am going to feel for your liver, okay? Any tenderness?
No.
Okay, I feel your liver. So now I'm going to attempt to feel your spleen, okay? Any tenderness?
No.
Okay. And your kidneys. Okay, you can sit up. All right, and no tenderness when I was palpating or feeling your liver, spleen, or kidneys, right?
No.
Let's see. So what I'm gonna do now is I'm going to listen to your bowel sounds in all 4 quadrants, just pretty much just trying to hear if you have active bowel sounds. Are they hypoactive, not as many? Are they hyperactive? So hypo would mean constipated, hyper means you got to keep going, and just active what we want. And we normally listen to bowel sounds before we press in your stomach or anything, because pressing in your stomach before listening to bowel sounds could trigger bowel sounds. And we don't want it to do that. Okay, and now, so your bowel sounds were active. I did hear bowel sounds in each quadrant. It didn't sound like they were overly active. How have your bowel movements been? Are you regular?
Yeah, I'll say at least once every day.
Okay, so now I'm going to just kind of feel each quadrant of your stomach, and I just want you to let me know if you feel any tenderness, okay?
Okay.
Okay, so now I'm just gonna see if I could kind of listen for your liver, make sure it's not enlarged or anything. So if you could just lay back. Your liver, top of your liver starts right there. All right, you can sit up. Alrighty, so now we're gonna do the vascular portion. I'm just gonna take a look at your jugular vein. Okay, I'm not noticing any distension. Can I take a look at your fingers? I like your nails. Let's see. Okay, capillary refill appears to be less than 3 seconds. I don't see any clubbing in the toes or the fingers. I'm gonna feel your carotid pulse. Okay, now I'm going to feel your radial. And your brachial pulse. Okay, I'm gonna feel kind of right here in your femoral area for your femoral pulse. Did you know you had a pulse there?
No.
I'm gonna feel your pedal pulse on your feet. your tibia post, which is on the side of your feet, and the post that's behind your knee, your popliteal post. Okay, so as you can see, we have posts everywhere. Now I am going to attempt to listen to some of your pulses. I'm going to listen to your carotid pulse. Okay, and if you could lay back, I just want to assess your aortic, your renal, your iliac, and your femoral pulse. Okay, your renal, your iliac, and your femoral pulse. Okay, you can sit back up now. So the exam is almost over. We're just going to test 2 more body systems, your neurological body system and your musculoskeletal. So for your neurological, what we're going to do is the finger to nose test. Okay. So you're going to touch your nose and you're going to touch my finger and back to your nose. Okay? Okay. Okay. Perfect. Perfect. So now we're going to do something called the Romberg's test. The way that you do that is you're going to have your feet close together and you're going to close your eyes, okay? Okay. You did good. Now the next test that we're going to do is the heel to toe test, kind of like what police do for a DUI. You're gonna walk heel to toe, okay? Okay. Perfect, thank you. So now I'm just gonna take a look at your backside. I'm gonna actually just look at your spine and your scapula. Okay, and you're standing straight up. Okay, you can have a seat. So your spine looks straight in midline. I don't see any evidence of scoliosis or anything. Are you having any back problems or anything you want to talk about?
No.
Okay. Now what we'll do is kind of test the range of motion in your upper and lower extremities. So let's see. Could you hold your arms out for me? Okay. And extend them up. Okay. And you can flex them back down. Okay. And to the side. All right. And put them back down. And you could kind of flex and extend your neck for me. Perfect. Now we're gonna do pretty much the same with your legs. Could you kick your legs out for me? great. To the side. Perfect. All right, so it appears that you have full range of motion in your arms and your legs, so that's great. We're gonna check your strength, small strength test. What you're gonna do is just squeeze my fingers as hard as you can. Okay, pretty strong. And now you're going to press down on my feet as if you're pressing the gas pedal, okay? I mean on my hands with your feet. Perfect. All right, Jasmine. Well, this concludes our head to toe assessment, and I would again like to thank you for allowing me to conduct the assessment on you. Thank you. Yay.